Today, surveys show a growing segment of plastic surgery patients are younger, more middle class, and male. And they're getting nipped and tucked and tightened for reasons you might not expect, like staying competitive in the job market. Sylvia Chase explores the dramatic advances in technology that are changing the face of cosmetic surgery.
Its name comes from the Greek, plastikos, meaning moldable. Today, as never before, it has created the potential for the human form to be molded. Some say sculpted by the hands of a surgeon. It is plastic surgery. More and more people, even some who never thought they would, have been wondering, what could it do for me? Linda has, and so has Susan.
The one thing I really would like surgery to correct is my jawline.
These puffy overhangs over my eyes and take away these scowling marks on either side of my mouth and give it a little bit of a tighter look so that it doesn't look like there's a double hanging chin there.
As the marks of age begin to show on a generation of people accustomed to questioning the way things are, and new advances in plastic surgery offer them more possibilities of the way things could be. Linda works as a product label designer. Susan is an educational consultant. They are both 48 years old.
When I look in the mirror, I do not see myself anymore.
I see kind of this weary, tired-looking lady, and yet I don't feel tired.
There'd be one part of me that would long for my old look.
I want to look on the outside how I feel on the inside.
One of the most important things that we do when we screen patients for cosmetic surgery is to ask a series of questions that help us to determine what their reasons are.
Dr. Kate Altork is a psychotherapist in Florida and an expert on the psychological aspects of plastic surgery. What are wrong reasons for having plastic surgery?
The first reason would be that the person is in a crisis, that they're going through a major change in life. That's a bad time.
But none of that applies to Linda and Susan. And on this wintry day at their homes outside New York, they have already made up their minds. In a few days, they will each undergo a facelift. Another person has made a decision, too. You are going to have plastic surgery.
Yes, I am.
It's these deep pit acne scars on her face that Dr. Altork has long wanted to remove.
I waited for technology to catch up with my dream.
What are you going to have done?
I'm going to have full-face laser resurfacing.
It's a technology that has advanced in just the last 2 years. Dr. Robert Cooper will perform the procedure with the latest ultra-pulse carbon dioxide laser, which can erase fine lines, diminish deep scars on human flesh. It's one of plastic surgery's newest and most powerful technologies.
Bordering on military power, this is a very, very strong instrument.
Dr. Cooper tests the shape and intensity of the laser beam on a water-soaked wooden tongue depressor.
If this was paper, this would be on fire right now. You have the aluminum foil to protect the drapes and everything from catching on fire. And we're putting in some eye shields now to protect our eyes. This beam of light has as much force across the room as it does at 3 inches.
It is power harnessed with precision. Watch. Cooper takes aim at the marked acne scars. The laser actually vaporizes layers of scarred skin. Then he attends to the rest of her face. In untrained hands, this powerful beam could cause deep burns.
You can usually see some very dramatic tightening of the skin.
The new skin beneath will be smoother as well as tighter. But first, there will be a price to pay. What is the recovery period for laser?
Well, I think it's a lot longer than advertised. A week of genuinely raw skin that has to be covered until that's healed. It looks as if you slid into first base on your face.
Dr. Gerald Imber is a prominent New York plastic surgeon.
It's weeks and weeks and perhaps months of pink skin that must be covered with makeup.
People expect before and after with no interim period. I think it's important for people to see the process realistically so that they can decide whether or not they want to go through it. Do I look like mommy to you?
Except for your face.
Seeking a surgeon out of town isn't at all unusual. Privacy may be an issue, Or the reputation of the out-of-town doctor may be the draw. Our New Yorkers have come here to Stuart, Florida, where after surgery they will recuperate for a week under Dr. Cooper's care.
We're going to do some marking now.
Each woman's operation will require some cutting and sewing and some newer techniques.
Smile gently. There's some fat pads here we're going to want to take out from inside.
Linda and Susan's eye jobs will call for incisions in both upper and lower lids. Facelift incisions will be longer than you might expect, but mostly hidden in the hair.
Getting ready, I wanted to leave, flee, big flee response. But once I saw my pre-op pictures, I decided I'd stay for the duration.
Linda's surgery is first, then Susan's.
You hope that everything goes as you want it.
The surgeries begin. It will take Dr. Cooper between 2 and 3 hours for each patient. He makes the incisions, suctions fat from beneath the chin, and tightens underlying muscles to reshape the jawline. Then redrapes the skin.
That looks about right. If you tighten the bottom sheet on a bed, one is then able to pull on the top sheet very gently and it can lie without a wrinkle.
Want to see this wrinkle disappear? Watch.
We pass the laser on either side of this deep crease, and what that does is it tends to pull up the crease and flatten it out.
For the next 2 days, Susan and Linda must recover quietly and carefully so as not to disturb their sutures. Bags of ice would be too cold and stiff, so yes, those are peas, you see. Frozen peas. A modest reminder amidst all the high tech of what is natural. There is great beauty in life, in what is natural. But what kinds of notions of beauty do we share with our young? At this age, a baby has no sense of body image. But by the age of 2, preferences begin to emerge.
Very pretty.
Are the images we project onto our children leading to dissatisfaction with themselves as they are? Studies show almost half of American women are seriously unhappy with some aspect of their bodies. But
What if they like their work and they like their family and they do take good care of themselves physically and they still feel at odds with a part of their own being? Then what? Then do we have a right to change that?
2 days have passed since Linda's and Susan's surgeries. They look awful. But listen to this.
There's really no pain.
It doesn't hurt, so you really can't complain.
It's really remarkable. It took me years to really believe it. Once we separate the skin from the underlying tissue, it takes several months for those sensory nerves to grow back in so that they have numbness.
At 1 week, bandages come off.
I can't wait to see what's underneath.
Sutures come out.
Taking little side peeks to see that nothing came back. I'm looking for my chin. I don't want it to show up unexpectedly.
Linda's skin is healing quickly. She learns how to cover up the lasered areas with makeup. But all that Susan's lasered skin can tolerate is Vaseline.
Great shade of hot pink, but it's a little pinker than I had imagined.
Then it's back home to New York for several more weeks of recuperation.
Bye.
Imber advocates smaller procedures, little repairs as needed.
People who are interested in maintaining their appearance throughout their adult lives should do little things as they come up.
So my friend was right when she said to me, the secret to a happy life, Sylvia, is tiny tucks.
You had a smart friend.
Can you take a tuck in a love handle? At 33, Jeff plans to take a few days off from work and lose his love handles. And his double chin, too. How? Liposuction. If laser uses the beam technology of Star Wars, then liposuction is closer to, say, a vacuum cleaner. It's not a weight reduction technique, but it will remove an isolated pocket of fat forever. Little wonder it's the most common cosmetic procedure, even though swelling lasts several weeks.
During that decade, between 30 and 40, there are changes that begin around the eyes and around the mouth.
That's where microsuction comes in. A miniaturization of liposuction, a new technique to combat early aging.
What we do is remove the fat from this area and sometimes even transplant it into the wrinkle as well. So we've smoothed this area by removing the fat, and we've filled in this area by transplanting the person's own fat into the crease. And it relieves both.
Though the fat injections need to be repeated, before results seem lasting.
The sort of thing that takes 15 or 20 minutes, and in most cases you can go out to lunch afterwards and no one will be any the wiser.
54 days have passed since Linda's and Susan's surgeries. Studies show a wide range of satisfaction with results, from 65% all the way to 95%. Are these women happy?
The surgery has rejuvenated me. I enjoy having people turn their heads again, which I haven't had for many years. I think it put a sparkle in my eye and in my life.
Oh, I'm very pleased. Everyone has an image of themselves, and I don't think that image changes or sags. And so now, the image that I have of myself inside is the image that I see outside.
But the lingering redness of the lasered areas still bothers Susan.
I probably would think very seriously before doing the laser again.
What about Dr. Kate Altork, whose entire face was lasered?
I'm healing much more quickly than I thought I would. I didn't expect perfection. I expected improvement. So the scars that remain don't bother me.
Kate Altork could not have altered her appearance had her face been scarred 100 years ago. But as the millennium approaches, technology has taken its place in the cycle of nature, offering risk and choice, even in the landscape of the human body.
Cosmetic surgery is expensive and complications do occur. If you're considering a procedure, contact the American Society of Plastic and Reconstructive Surgeons for the names of board-certified doctors in your area.